Growing up, you play school and you play house, and we always played hospital, so I was always the nurse.
I became a nurse because I was a patient. I used to drive trucks way back, and I had an accident, a motorcycle accident on the way home one night, and I wound up in traction for 6 weeks. And the nursing care was just fabulous.
I actually had a very dear girlfriend that had a brain tumor when I was in high school.
I think it's a family tradition. My mom's a nurse and I have other cousins and stuff. So, it just appealed to me. My mom loved her job so much.
So whatever it was she was troubleshooting, she went there, she problem solved, and she fixed it. And I just remember thinking, that is awesome. I think I want to do something like that.
I knew that when I walked into the room to take care of those patients, and when you look into their eyes and you make a difference for the patient or the family, I knew I had done the right thing.
When you look at nursing and why people select that field, it remains always the same thing. People who really want to make the world better, who want to care for patients, and who want to bring and be with people in times of crisis and bring strengths to those folks that they have learned through the science and the art of nursing. Everyone needs somebody who will stay the course with them and give them the courage to keep moving forward in life, no matter what the hand is that they're dealt with. So when you begin to look at who can do the work of nursing, I will tell you it takes a very skilled, committed person who brings energy, enthusiasm, because every day there's the opportunity for a gift to be had from the patient. So I'm glad to introduce to you many nurses who will share with you those moments of specialness that have made their lives significant.
What's your favorite part about being a nurse?
I like that nursing uses every bit of your being. It uses your intellect, it uses your emotion, involves your spiritual side, and get to combine all of that in everything you do.
Probably the fact that everything that you do in your nursing practice is for the better of the patient.
Getting to see the patient come back from, the worst point in their lives to all the way back to normal is great.
The part that really drew me to being the nurse is like the patient interaction, because I feel that's like the part that's really like principal and paramount.
Sometimes it's not all about medicine. Sometimes it's just lending an open ear. Just sitting there and actually listening to them could be enough.
Just being able to have one-on-one friendships. In the transplant population, we see our patients come back and forth many times with infection, rejection, you name it, and we just get to know them very well.
My favorite part is changing people's life when they have reconstruction for whatever reason. It basically provides the opportunity to give people back their lives when they've had cancer or some kind of catastrophic accident.
In the OR, we have a really unique opportunity to take care of patients. The patients are asleep, so they really leave their safety, their life in your hands. I take a lot of pride in that. I take it very seriously, and I love being able to be a patient advocate.
My favorite part of nursing is just being somebody's family member when their family member can't be there.
Talk to me about how hard it can get at times.
I've worked on hospice unit, and they say dying is the easy part. The hard part's the living after your loved one is gone. So, really supporting the family and being there for them in probably the hardest time they'll ever have to live through.
But that can be a good day too, because you're helping a family through that process, and it's very personal. Just like coming into this world, going out can be pretty special as well.
What have you learned from all of the patients that you take care of every day?
They teach me how to be calm. They teach me how to think about what we're going to do, how we react in certain situations.
The families love so sacrificially. They're with these patients at their absolute, worst and weakest moments, and that's who they love. And it just teaches you, that's not just a person on my to-do list. It's a person that I get to impact their life and take care of.
It's really about being around for more birthdays, more holidays, more time with family members. You realize what's important in life, and it really puts it into perspective.
I really learn to treat them how I would want myself or my mother to be treated.
To enjoy my life every day. A lot of wisdom You get to hear about a lot of how people have lived their lives, and so you get a lot of pearls in your day that you can take home and use as well.
Taking it one day at a time. My dad was currently diagnosed with stage 4 cancer, lung cancer. So at first as a nurse, you just kind of do your work. You just, you take care of your patients, but when it hits home, then that's when you realize that is what my patient was talking about. Just take it one day at a time.
I know what I've learned from my patients is just that it's okay to be vulnerable, it's okay to feel, and it's okay to cry. Sometimes what they want is just someone to cry with, and that's okay too.
I absolutely love working here at Methodist.
I love the people I work with, and I wouldn't trade it in for the world.
They're always encouraging us to be the best nurse we can be.
It's neat to be able to be proud of, not only your profession and what you get to do with your life, but who you get to do it for.
Oh, I love telling people I work here because I know our reputation around the world.
We have some of the most amazing doctors, and they have a close working relationship with the nurses.
We're obviously doing something right for people to keep coming to us.
I can tell you at the end of every nurse's career, they will never ever ask the question, I wonder if I made a difference in this life.